It's time to feel better with help from Dr. Susanne Bennett. Allergies, nutrition, ultimate wellness, all discussed right here, right now. It's Wellness for Life Radio on Radio MD. Here's your host, Dr. Susanne.
Yes, I have to confess, I have the superwoman syndrome, a very common condition many women in America suffer from that can trigger stress-related symptoms and illnesses. But I also know how important it is to find stress relief every day to prevent diseases. Now, what do? I play with my puppy Lola. I do aerial yoga, go into inversion therapy, deep belly breaths, and basically practice the power of the now, being more conscious to live in the moment. Now, Matt, my next guest, believes that stress can be easily fixed with small changes despite your busy daily superwoman routine. Let's welcome James LaValle, board-certified clinical nutritionist, metabolic expert, and author of Cracking the Metabolic Code and Your Blood Never Lies. Great to have you here, Jim. Thanks so much. I'd love to jump right into your stress-busting strategies.
Oh, that'd be great. I think there's a few things that you really have to think about, right? When you're thinking about stress, there's baseline things that people need. I know we mentioned it when we were chatting before that you got to get enough magnesium in your body. I love two compounds called Valora and theanine. And I think the big thing is women have to start understanding that, when stress has got you by the tail and it's whipping you around, don't make the bag of chips or the next bag of cookies your best friend. You gotta understand that, with stress comes craving patterns, and you got to take control of that. Otherwise, you end up, you eat more starches, you eat more sugars, you eat more comfort food. All of that relates to insulin resistance and driving more adrenaline to be released in your body. And really, the other thing it leads to, when you think about entering into menopause, more women die of heart disease than men. So once women lose estradiol, they don't have that heart protection that they used to have. And so that stress really starts to put pressure on your blood vessels. I love that you teach deep breathing techniques and diaphragmatic breath. I think it is so important that women understand that deep breathing techniques are just super important for balancing your sympathetic nervous system so that the fight or flight, that white tiger syndrome, doesn't get the best of you.
Oh, you know what? I love what you're saying about that sympathetic dominant state, because I think that some of us, come into this world being stressed out, even in utero, inside the mother's womb, because the mother was stressed out. I think that actually was in my situation. I came out like kicking, and I was stressed from the moment I was born, and my life has all been about balance, looking for balance. And you talked a lot about the women and how, actually the stresses can be triggered by dieting alone. A lot of women, I don't put women on diets. I really don't believe in dieting, and it's really all about making sure you eat the high quality, dense, nutrient dense foods, and creating a balance in your life. That's one of your quick stress fixes too, isn't it? That you don't recommend people to diet.
I think dieting is a huge mistake, and it's the wrong signal. We need to teach people how to eat healthy food. How do you eat foods that are going to nourish you and keep your vitality as you're aging? We all deserve vitality at every stage in our life. And so it's important to understand, you got to eat nutrient-dense foods. I got to tell you one thing, though. I started teaching people how to count carbs again because we've been doing studies on weight loss in people and bringing them in and actually doing diet intervention with them and figuring out what they're picking. And they're eating sometimes 4,000 calories a day with little or no exercise. And it's because they don't understand portion size and serving size. And so when people say, well, I eat gluten-free, well, yeah, but if you eat a box of gluten-free cookies, it's still too much starch and still too much sugar. It's about making smart choices. And so, so when you do eat starch, I really like a dietary supplement called Phase 2. The reason for that is that when you take Phase 2 carb controller, which is, several companies have that ingredient in their products, so I'm not embellishing any one company, but it blocks the starch uptake into your bloodstream, and so I dampen the glycemic response. And that means I'm not going to plaque my arteries. My blood sugar's not going to go up. I'm not going to trigger more insulin. I'm not going to store fat. And I also end up creating more resistant starch. And resistant starch goes to the lower intestine, feeds the beneficial flora. And then what happens is that beneficial flora can send your satiety hormones like glucagon-like peptide hormone, GLP, PYY, which is another hormone that your intestinal microbiome releases. It tells your brain you're no longer hungry. And we've got to get people to understand stress drives hunger and appetite. When you're a superwoman and you go for that first cookie and all of a sudden you see you've eaten 6, that stress is having an impact on your brain neurochemicals, leading to those poor food decisions.
That's one thing that I highly recommend is to eat regularly. For instance, if I were to skip a meal, forget it. I am not a super woman. I am a crazy woman. I can't stand how irritable I get when I don't eat. So I'm very careful about, eating my meals appropriately at a specific timing. And that's super super helpful. Speaking of timing, one of the things that I also recommend to my patients is sleep. Isn't sleep one of your quick fixes?
Probably one of the most important things you can do is get 7 to 9 hours sleep a night. And a lot of times people don't realize that when you're having trouble sleeping, meaning that you can't get to sleep or you wake up between 2 and 4 a.m., it's because your awake brain is too active and your sleep brain is not active enough. So we have an awake brain that takes on the stress of the day, and we're supposed to have a sleep brain that repairs our brain and other body processes during the course of the night. And so if you're not getting adequate sleep, you are eroding the neurochemical balance and immune balance that comes from your brain and signals to your body how you're going to maintain your health. So getting adequate sleep is so important. I'm a big fan of people, if they need to use things like melatonin. They obviously can do visualization. I like apps like, Brainwave is a great app to help people to kind of entrain themselves to get into a deeper sleep. But the big secret is, if you're having trouble getting to sleep, look at the stress of your day and figure out how you can manage it more appropriately, whether it's through breathing, using supplements like theanine or holy basil or Lelora to help dampen your stress response without you feeling drugged and allowing your body to go into its sleep state.
What I use, I commonly recommend to my patients to sleep better is actually get rid of the light in your room.
Well, sure.
Oh my God, blocking
absolutely.
the room, black light. And I even tell people to use masks and earplugs to really totally knock out any stimulation. And that makes a big difference.
It really does make a big difference. And don't have your dog sleeping in your room because your dog starts to itch and they howl a little bit. Maybe your dog's snoring. Maybe they've got an allergy to their food. Who knows, right?
Yeah, that's right. That's a very good point. We are all dog lovers. My dog has her own little place downstairs and never comes up to our bedroom because that's exactly it. I love my sleep. And I think that sleep is what has kept me much younger and more vibrant and being able to handle the superwoman lifestyle.
Well, without a doubt, super important. And the other one is get your vitamin D levels checked. I mean, a lot of women don't have enough vitamin D. When the vitamin D levels get low, your mood gets low, your gut starts to break down. You're more prone for things like breast cancer with low vitamin D status. And I got to tell you, whether you're in Florida or California, I always see vitamin D being one of the big issues that still plague most of us in this country.
Yeah, you're so right. Jim, great information. Regarding vitamin D, I think one of the reasons why we're really low is because we don't have the gene, the VDR-TAC gene. It's a genetic that you can find if you ever get your genes mapped. And I actually have the double allele for that, which means I have to take vitamin D supplementation. All right, website is JimLaValle.com. Thanks so much for being on our show. This is Dr. Susanne sharing natural strategies for ultimate health and wellness right here on Radio MD. Until next time, stay well.